There are lots of opportunities for pharmacists to, from a self-improvement process, to always better themselves with regards to documentation and communication. Those are aspects that I myself am always working on. With regards to documentation, even if pharmacists at the institution are not responsible, not the primary recorders of the code event, as at many institutions, possibly a nurse might be the designated recorder of the code event. Even though in those cases, pharmacists at minimum should be documenting what medications are administered, which kind of makes sense. This helps in many cases to prevent almost backtracking, and we have that information readily available. Many times during codes, since we're given the epinephrine maybe every 3 to 5 minutes as an example, if a pharmacist keeps that documentation with regards to when that last dose of epinephrine was given, it can prevent maybe time delays and other interventions down the line. Going beyond the medications though, I think it is advantageous for pharmacists to document other aspects of the code event as well too, even if not one of their normal duties. For example, during codes, even though at the institution I practice at, it's not an expectation that we do documentation, I will write down the times we do rhythm checks, the times we shock the patient, and other noteworthy events as well too. Because what I found is after a code event, I can go to the primary recorder, which at our institution is a nurse, and ultimately compare notes. And then what we can do is actually have a more accurate record of what actually occurred during the code. Because it's, honestly, code events can be massively sensory overload. There's a lot of personnel in the room, a lot of stuff going on at the same time, and by ultimately having 2 people in the room writing down information, you get better results, ultimately, in a record of what actually happened. As it pertains to communication, again, many different opportunities with regards to pharmacists and improving our abilities with this. I make a point whenever I enter the code room to announce myself and say, I'm Andrew, I'm the pharmacist, and I can help you out with medications or finding other aspects, and kind of briefly summarize kind of what I can do for them. Since I work in the emergency department, for the codes in the emergency department, most staff know me, so I might not necessarily do that, but if I go to maybe a code on the floor, nursing staff, physicians are less likely to know me, so there's much benefit for announcing your presence as a pharmacist and that you're there and that you can help them out, basically. An important aspect, pharmacists can help out by instilling closed-loop communication. What I mean by that is to make sure that all aspects of the code are communicated multiple times. For example, let's say the code leader asks for epinephrine, 1 milligram. So what I'm going to do as a pharmacist is I'm going to say, okay, I'm going to acknowledge that I heard that request for the epinephrine. I'm going to say, okay, I'll get that dose of 1 milligram of epinephrine. Then what I'm going to do is when I have that dose of epinephrine ready, I'm going to let the nurse know who is administering the medications and say to that nurse, him or her, that here you go, here's the 1 milligram of epinephrine that was ordered. And then ideally, after the nurse gives the medication, he or she should say 1 milligram of epinephrine administered. So we can track that along down every point in the sequence and ultimately know when that dose of epinephrine was given. And so there's no questions as to what's to come and what already happened. Also, it's important to note, during really long codes, sometimes teams can actually kind of lose focus with regards to the matter at hand. I advise that even if there's a long code going on, pharmacists and other healthcare providers should keep extraneous chatter and communication down to a minimum. Even if precepting students and residents, or maybe have some learners with you, if nothing else, keep it to like a whispering voice, etc. Because we have lives at stake, and we need to make sure that all is happening to better patient care. So in some codes, it can, especially after long codes, it can get quite loud in the room, and communication outside of the necessary minimums in terms of interventions that are being performed, etc., should be kept to a minimum. And my last piece of advice in terms of communication for pharmacists, actually if you have a valuable intervention that you think should be considered, please speak up. Again, we have patient lives at stake, and if you think you have a piece of information that might alter any interventions performed by the code team or better patient care, speak up. Let the code team member know, because it could potentially change outcomes for the patient.